rẹ́ni bá ní kọ́lé, a lè rẹ́ni bá ní náwó. Kò mọ̀ sẹ́ni tó lè ṣàìsàn àtọ́jú ara wa. Àlàáfíà tayọ. Àlàáfíà yìí ṣe pàtàkì, ó ṣe kókó nínú ayé ẹ̀dá òkú tẹnu mọ́. Bàbá lógún ẹrú, bàbá níwọ̀fà ọgbọ̀n, láì lálàáfíà òfò ni. Ká jẹun tó dára lásìkò, ká fara nísinmi. Kórede ẹ̀mí ìṣẹ́gun jẹ̀mí ènìyàn lọ, bàbá wówó àwàjù àìsàn ní ó gbẹ̀yìn ẹ̀. Ogun tó gbé mọ́tò lọ sọ́run, àlàáfíà yìí ṣe pàtàkì, ó ṣe kókó. Ó níye tán tómi, ó níye tán tẹ̀yìn, ó níye tán ta.
A tún ti dé láàárọ̀ ti tòní nìyẹn lórí ètò yín ètò wa ètò àṣírí ìlera ní ìkànnì aláṣẹlá I-FLIER 103. Sá fún tàbá jẹun tán, jíjẹ èso lẹ́yìn tàbá jẹun tán. Ó yẹ ká máa fún oúnjẹ tá a bá jẹ ní ìsinmi kọ́kọ́ lọlẹ̀ ná ká tó mu èso ká tó jẹ, pàtàkì pé ká mọ àwọn nǹkan tó yẹ ká máa ṣe tá a bá jẹun tán, nǹkan tó yẹ ká sá fún nígbà tá a bá jẹun tán. Kẹ̀dẹ̀ tó jẹun náà bóyá 30 ìṣẹ́jú ni o, wákàtí kan kẹ́ tó jẹun, kí ni àwọn nǹkan tó yẹ kẹ́ ẹ ṣe. Tẹ́ bá jẹun tán náà 30 ìṣẹ́jú, wákàtí kan tàbí wákàtí méjì lẹ́yìn tẹ́ bá jẹun tán, kí ló yẹ kẹ́ ẹ máa ṣe. Torí pé tẹ́ bá jẹun tán méjọ kórede ká mú kúrò lánàá lọ́sọ̀ tó kọjá ni wípé tá a bá jẹun tán ẹ jẹ́ kó oúnjẹ yín kọ́kọ́ sílẹ̀ náà. Ẹ lè rìn díẹ̀, ẹ lè jókòó sójú kan, just make sure that ẹ sọ pé ẹ fẹ́ dùbúlẹ̀, ẹ sọ pé ẹ fẹ́ sùn, tó ń bá ti fẹ́ máa gbé yín lọ ẹ dìde kẹrin díẹ̀. Àkọ́tẹ́ tún lè ṣe nìyẹn, so that oúnjẹ yín á lè lọlẹ̀, á lè digest dáadáa. Àní máa ní pé ikùn mi wú, kò ní máa di pé mo ẹjọ́ ẹ jẹ́ ká kíyèsí yẹn, ó ṣe kókó ṣe pàtàkì. AC SS a dẹ̀ sọ̀rọ̀ nípa àwọn tó lè fẹ́ ra wọn, irú genotype wọn ló wípé àwọn tó bá ti jẹ́ AS, AA ní kẹ́ ẹ máa lé bí ìjọba ọ̀run, AA ní kẹ́ ẹ máa lé tó bá jẹ́ pé AS níyìn tàbí any of the other sickle cell, bó jẹ́ AS, SS, SC ẹ máa lé AA. Ṣùgbọ́n tó bá ti jẹ́ pé ẹ̀yin jẹ́ AA, any opportunity ẹ láǹfààní láti fẹ́ any of the genotypes, kó jẹ́ AS ní, kó jẹ́ SS ní, kó jẹ́ SC ní, kó jẹ́ AC ní, kó jẹ́, in fact ẹ ní àǹfààní láti fẹ́ anybody as long as you are AA. Òun la kọ́ níbi ọ̀sẹ̀ méjì sẹ́yìn. Láàárọ̀ ti tòun àtúntì dé, ẹ ti mọ̀ wípé a máa mú full package wá fún yín lórí ètò àṣírí ìlera. Ẹ ti mọ̀ wípé tẹ́ bá ti gbé ètò àṣírí ìlera ní gbogbo ọjọ́ Thursday níkànnì aláṣẹlẹ̀, ẹ ti mọ̀ wípé yálà nínú obìnrin ni yálà nínú ọkùnrin ni. So àní sọ pé torí pé obìnrin nìkan ló máa ń sọ pé tó ń bá tètè bímọ is woman's fault. Who says it is the woman's fault? Ó sọ pé àwọn obìnrin ló fà tó fi jẹ́ pé wọn ò fi rọ́mọ bí. Nítorí láàárọ̀ tìtò máa wo nínú ọkùnrin àti nínú obìnrin. Dr. Favour Okoye náà máa dé ṣàlàyé gbogbo ẹ̀ fún wa láàárọ̀ tìtò ní. Ẹ yẹ gbé dókítà mi wọlé torí ọjọ́ ti lọ, ẹ jẹ́ sáré gbé wọn wọlé láàárọ̀ tìtò ní kí wọ́n bẹ̀rẹ̀ sí ní dáhùn àwọn ìbéèrè tá a ti mú wá láàárọ̀. Tẹ́yìn náà bá dẹ̀ ní ìbéèrè nǹkan tó bá fẹ́ bí dókítà wa, ẹ láǹfààní láti béèrè. A máa ṣe ojú òpó tó bá ti yá kẹ́ lè pè wọlé kẹ́ béèrè ìbéèrè yín nípa nǹkan tá a mú wá fún wa láàárọ̀ tìtò ní o, torí wípé àròjọ mú solókùn. Ẹ jẹ́ ká ṣe gbogbo ẹ̀ ní kíákíá, kámọ́ kíá, mò ń bọ̀.
Ọ̀rọ̀ ṣe wáyà rí rẹ̀, ó fẹ́ jẹ́ ṣe kọ́rẹ́ǹtì tí yóò dẹ̀ fi kan para wọn lára. Ẹ̀hún tó dára lásìkò, ohun tẹ́yẹ bàjẹ́ lẹ́yẹ máa gbé fòkórede. Àlàáfíà lògùn ẹ̀mí o, ìlera lọ̀rọ̀ mo wí. Àlàáfíà tayọ. Ìlera lọ̀rọ̀ kórede. A lè rẹ́ni bá ní náwó, a ò rẹ́ni bá. Láyé tí mo wá máa gbádùn ara mi, má padà nù láyé o. Láyé tí mo wá máa gbádùn ara mi, má padà nù láyé o. A lè rí gbogbo ẹ padà ṣùgbọ́n tábàjà bàbá gbọ́.
Ẹ wípé dókítà wa Dr. Favour Okoye. Doctor.
Hi, good morning. Thank you so much. I'm very happy to be here too.
Okay, thank you very much. All right, so I told our listeners at home that we want to talk about infertility. Also, would want to call in and ask you questions based on what you've brought this morning. So, first and foremost, what is, like I said, we want to look at infertility in men and in women, males and females, not just one gender. So, what exactly is infertility and what causes it in both male and female? All right, hello?
Thank you so much.
Okay, okay.
So I'm guessing this conversation. Can you hear me?
Loud and clear.
Oh, okay. So I said thank you so much for hosting me once.
Thank you for coming.
Okay. Thank you for hosting me, and I'm taking this conversation we're about to have. Being like the listeners above 18. Okay. So I'll just start with the definition of infertility. Infertility is the inability to achieve a successful pregnancy in people having regular intercourse for at least a year. Okay.
Regular what?
That's like for female. I'm sorry.
You mentioned regular something, so that we can hear it loud and clear.
Yes. Regular unprotected sexual intercourse.
Okay.
For at least a year. Okay.
Okay.
So it's like for people who are trying, to have a baby and they've been having sex at regular frequency for at least a year. If they are unable to get pregnant at that point, then we can say like, okay, they need to start going to the hospitals to like do like a workup for infertility. So it's at that point that.
Okay. All right. Okay. I think we're trying to get him, and I hope that the network is going to be favorable. Okay. We can hear you.
Can you hear me now?
Yes, loud and clear.
Okay. So, do you need me to start again from the beginning?
No, you mentioned that if for couples who are trying to have maybe unprotected sex for a year and they still can't give birth.
Yes.
Okay.
That's right. Yes. And then I was trying to explain that the definition is a bit dependent on the females. She must have tried for at least a year with her partner.
Oh,
but
okay.
if she's 7 years and above, then we use 6 months.
Okay.
She must have tried at least for 6 months with her partner.
Okay.
And then if she's unable to have a baby after 6 months, then she and her partner, they should go to the hospital for workup and if there are like any issues that can be resolved there.
Okay. What about for the males?
So for the males, they don't really have some sort of time stamp.
Okay.
In the sense that the reason we use 35 years for females is because of at 35 years of age, that's when the ovaries sort of the function starts to decline very fast, right? And we all like ovaries for females. That's where like the eggs are stored, and which is again plays an important role in pregnancy.
Okay.
The thing is, for males, the older you get, the more like likely you are to have life. Does that make sense?
Okay. So let me explain to our listeners in Yoruba. Fún àwọn tó ń gbọ́ wa nílé, dókítà wa ṣàlàyé wípé fún obìnrin, torí pé mo ṣe sọ tẹ́lẹ̀ à ń sọ̀rọ̀ nípa nǹkan tó máa ń fà á tí bóyá obìnrin wọn kì í rọ́mọ bí àbí ọkùnrin. So à jẹ́ kí ó jẹ́ general thing both for males and females. Wọ́n lè ṣàlàyé pé fún obìnrin, nǹkan tá a fi máa mọ̀ bóyá tàwọn sọ pé a fẹ́ fi define àìrọ́mọ bí ni wípé bóyá fún obìnrin tí ò tí wọ 35 years. Tí ò tí wọ 35 years, bóyá àwọn àti ẹni tó ti jọ fẹ́ra wọn wá ń try. Wọ́n jọ ní ìbálòpọ̀ bóyá fún ọdún kan tí kò dẹ̀ sí nǹkan kan tó jáde látàrẹ̀. A máa sọ wípé irú ẹni bẹ́ẹ̀ ó ṣeéṣe kí ẹpẹ́ ní orí ọmọ bí tó ní infertility. Àmọ́ fún ẹni tó ti kọjá tàbí 35 upward, wọ́n máa lo oṣù 6 láti fi wò láti mọ̀ bóyá ẹni yẹn ní kátà pé dáwọn pé ní infertility. Àmọ́ fún ọkùnrin, àwọn tí wọ́n ṣàlàyé wípé àwọn ò fi bẹ́ẹ̀ ní ọdún táwọn fi máa sọ pé bóyá fẹ́ lo bóyá wọ́n fẹ́ lo ọdún kan láti fi wò àbí oṣù 6 láti fi wò. Wọ́n ṣàlàyé pé tí ọkùnrin bá ti ń dàgbà, ó ṣeé ṣe kí ó jẹ́ pé máa ní low sperm count àbí tó máa affect production of that. Wọ́n dẹ̀ ṣàlàyé wípé ìyẹn ò túmọ̀ sí wípé ẹnìyẹn ní ọkùnrin yẹn ní infertility. Okay, all right, thank you, doctor. So now you have explained sort of what infertility in both male and female means. Let's now come to what exactly is the cause.
Okay, so when we look at the causes of infertility, I think it's very important that I mention that both male and female like play a role. Okay. What I mean is, in our society, we know like how easy it is to blame the woman, and most times, you know, the males are very quick to say, "Oh, like she has a problem," and so I want to be very clear to say that both male and female, they are responsible in getting pregnant. So like it takes two to make a baby. So what the causes of infertility, we have like the male causes of male infertility, and we have the female causes of female infertility. So I'll start with the male causes, and I'll start with you know, behaviors that we can modify. So I call them modifiable causes, right?
Okay.
So excessive alcohol consumption can affect the quality of sperm a man has. Okay. So excessive alcohol consumption is one of them. Recreational drug use. Recreational drug use is like, you know, you're smoking weed. So I'm going to put smoking cigarettes as well in that category, because of tobacco consumption there. And, you know, like other types of drugs, like, you know, being used illegally, all of that can affect quality of sperm, right?
For the male.
Also, lack of size, advanced age. Again, like I said, the older a man gets, the quality of sperm he has. So all of these are just, they are all what I call modifiable risk factors, except age, right? For age, we cannot really modify that, but the rest, we can modify, right? And then we have like the non-modifiable, you know, causes. Regulating a man's sexual appetite, and even the quality of sperm. It all comes from instructions in the brain. So if you have, or you've had a history of head surgeries, or you've had some sort of serious head injuries, that can actually it can affect your ability to have a baby later down the road.
Okay, so sorry to cut you. Let me quickly explain that to our listeners. Nǹkan tí dókítà ṣàlàyé sí ni wípé nǹkan tó máa ń fa àìrọ́mọbí fún ọkùnrin, infertility in men, ni wípé nǹkan tí wọ́n sọ, àwọn míì wà tí wọ́n ti sọ, ni pé bóyá èèyàn ti ní iṣẹ́ abẹ sí orí àbọ̀pọlọ, tàbí pé ni ẹ ní bóyá ó ṣìṣe lórí, bóyá ni ẹ l'accident ò forí gbálẹ̀ or something. Ipe irú nǹkan bẹ́ẹ̀ yẹn lè something. Ipe irú nǹkan bẹ́ẹ̀ yẹn lè fà kó di wípé ẹni yẹn lè má rọ́mọ bí fún ọkùnrin. Ṣé ti gbọ́? Because of course àní rò dé wípé orí bó lórí ṣe affect ìsàlẹ̀ ṣóyín, but ẹni wọ́n ti sọ sí pé hormone tó control àwọn kan lọ́pọlọ tó tún máa help àwọn ọkùnrin when it comes to the sexual aspect. Wọ́n ṣàlàyé pé tẹ́yìn bá ti rí head injury, bóyá forí gbálẹ̀ àbó ti ní head surgery, ó ṣeé ṣe wọ́n ti ṣe abẹ sọ́yọ́ orí àbọ̀pọlọ, ó ṣeé ṣe kó affect níní ọmọ fún ọkùnrin bẹ́ẹ̀. Okay, thank you, doctor. Please go ahead.
Okay, then the other like more common causes are the sexually transmitted diseases, right? So this also is very important because a lot of males don't understand. The more it actually affects your reproductive organ. So what I'm trying to say is there are cases where you have one man, you know, sleeping with multiple women and having gonorrhea, syphilis, and all that, and most times they're just like, oh, it's fine, I'll treat it. But the thing is, these recurrent infections can affect the pathway through sperm comes out. That's one. And secondly, it can affect what I call the factory where sperm is being made. Okay, so if it affects the factory where sperm is being made, then you end up having what we call low sperm count. If it affects that passageway where sperm comes out from, then it means you know, and that could be one of the causes. So that's why I'm trying to reiterate so that the listeners can also understand that this is a very serious problem. So that's why, again, for me, please, if you have a partner, stick to your partner. Just stay with your partner. Like it doesn't pay to have multiple partners. It doesn't mean you're man enough if you're having multiple partners. Again, it does not pay. So I would wait for you to translate that and now to the next one.
Thank you. All right. So kan tí dókítà wá ṣàlàyé tó lè fa àìrọ́mọbí infertility nínú ọkùnrin ni wípé lára àwọn kan àwọn ọkùnrin máa ń ṣe tó dàbí lifestyle tó máa ń ṣe bí kán máa mu ọtí jù, ìyẹn lè fa infertility nínú ọkùnrin. Kán máa fa sìgá, kán máa fa kinní, kán máa fa àwọn oríṣiríṣi ṣóyè yín, ara nǹkan tó tún lè fa àìrọ́mọbí fún ọkùnrin nìyẹn. Wọ́n jà ṣàlàyé, mo ti sọ tẹ́lẹ̀ wípé bóyá èèyàn ní injury ọpọlọ àbí orí, bóyá forí nalẹ̀ àbó ní iṣẹ́ abẹ sí orí àbí ọpọlọ, ó ṣeé ṣe kó fa àìrọ́mọbí fún ọkùnrin. Wọ́n dẹ̀ ti ṣàlàyé sí wípé STI àti sọrí lórí ètò yìí nípa àwọn pé ní ẹ̀yin ọkùnrin ẹ tún treat ní léraléra. Tẹ́ bá ní gonorrhea lónìí, ẹ ní syphilis lọ́la. Bẹ́ẹ̀ ní syphilis lọ́la, ẹ tún ti ní mi, ẹ tún ti kó mi, torí wípé ẹ̀dẹ̀ ti ń bá oríṣiríṣi èèyàn ní ìbálòpọ̀. Dókítà ṣàlàyé sí pé ó lè fa àìrọ́mọbí nínú ọkùnrin. Wọ́n dẹ̀ sọ kó tó bẹ̀rẹ̀ sí ní sọ̀rọ̀ nípa nǹkan tó máa ń fa àìrọ́mọbí nínú ọkùnrin àtobìnrin ni wípé both ọkùnrin àtobìnrin ni wọ́n lọ́wọ́ nínú ẹ̀. Tó bá jẹ́ pé obìnrin ò rọ́mọbí, kò túmọ̀ sí wípé obìnrin yẹn nìkan ló ní problem. Ó ṣeé ṣe kó jẹ́ pé ọkùnrin yẹn gangan ni problem. So both ways ni àtọkùnrin àtobìnrin lọ́wọ́ nínú pé bóyá ẹ̀rọ́mọbí, and that's because we look down the line. Kí lẹ ti ṣe sẹ́yìn? Tó bá yẹ pé ẹ máa ń ní multiple partners, ẹ wà faithful sẹ́nìkan, ó ṣeé ṣe kẹ́ kó bá obìnrin tá bá fẹ́ later. So ní ìsìn náà ti ń kọ ẹ jọ stick to one partner. Ẹ mọ focus lórí ẹnìkan, torí pé tẹ́ bá ti ń dípẹ́ tí ní STI, àwọn àrùn ìbálòpọ̀ tó yẹ pé tí ń ní ẹ tún ti wá ẹlòmíì ò tiẹ̀ tún treat ẹ̀ ń gbà mí. Ẹ jọ ó ṣeé ṣe kó fa àìrọ́mọbí nínú ọkùnrin, ẹ dẹ̀ máa affect obìnrin tẹ́ bá fẹ́. All right, doctor, let's now come to that of the women.
Okay, so for females, there are like a lot of things that can cause it, but again, lifestyle is important. So lifestyle is alcohol, smoking, just the same thing I mentioned for the males, and also sexual partners. Like you'd see some females as well, like they have multiple partners, and the risk of having that is you are, like it's possible for you to get STDs as well. And the thing is, for females, this untreated or improperly treated STDs, it can cause what we call pelvic inflammatory disease. Basically, what happens is when you get syphilis or gonorrhea properly in a female, it can affect the womb. It can affect, the passageway by which egg travels into the womb. It can affect all those areas, and then it makes it important. In as much as I'm advising men to stick to one woman, I'm also advising women to stick to one man. One man. And the other thing that can also affect is multiple abortions. Multiple abortion can again reduce your fertility level, in that it's like each time you have a baby and each time you abort it, each time you have a baby, each time you abort it, you end up causing some sort of scar in your womb. And what happens is it becomes a bit difficult later down the line, because you have something called adhesions that would form in the womb, and it becomes again difficult to get pregnant down the line.
Okay. Àwọn nǹkan tí dókítà ṣàlàyé fún tó lè fa àìrọ́mọbí fún obìnrin àti sọ́tọ̀ ọkùnrin. Wọ́n ṣàlàyé wípé nǹkan tá a sọ fọ́kùnrin náà pé kán máa kán yé mọtí lámùjù, kán yé fa sìgá, fa gbó nǹkan kan. Ara nǹkan tó lè fa àìrọ́mọbí náà fún obìnrin nìyẹn. Wọ́n dẹ̀ ṣàlàyé wípé bí wọ́n ṣe sọ fọ́kùnrin STI àrùn ìbálòpọ̀ tó jẹ́ wípé wọn ò tún wá ọ̀rọ̀ sókè pé ẹ ti ní àrùn ìbálòpọ̀ tàbí ẹ rí àwọn àpẹẹrẹ kankan lára yín, ẹ lọ sí ilé ìwòsàn ká bá yín yẹ̀wò, kan fún yín ní ìtọ́jú tó péye. Ara nǹkan bẹ́ẹ̀ yẹn ló lè fa àìrọ́mọbí fún obìnrin, torí wípé àwọn tí wọ́n bá treat àwọn kinní yẹn, àrùn ìbálòpọ̀, ó ṣeé ṣe kó lọ fa problem sí àwọn kan tó ń gbé ẹyin yín fún obìnrin, tó ń gbé kiri, tó ń gbé jáde, tó bá lọ fa problem síbẹ̀ ó ṣeéṣe kó di pé ẹni ò ní rọmọ bí wọ́n dẹ̀ ṣe sọ fọ́kùnrin náà ni wípé tẹ́ bá ti ní àrùn ìbálòpọ̀ ó máa affect quality nǹkan tẹ́ ń gbé jáde gẹ́gẹ́ bí ọkùnrin ó dì affect ibi pathway yẹn passage yẹn tó ń gbé àwọn kinní yẹn so tẹ́ bá ti ní àrùn ìbálòpọ̀ tètè lọ sí ilé ìwòsàn plus wọ́n tún ṣàlàyé wípé have one partner ẹnìkan ní kẹ́ ẹ mọ̀ tẹ̀lé ẹ mọ̀ tún sọ pé ẹ ní 1 2 3 4 5 kò túmọ̀ sí pé ọkùnrin ni yín kò túmọ̀ sí pé obìnrin ni yín kò túmọ̀ sí pé ẹ̀ ń jayé ẹ jọ̀ọ́ ẹ jẹ́ ká mú yẹn lò ìyẹn náà ṣe kókó ṣe pàtàkì. Alright, doctor, now we have talked about the causes. Let's look at the signs and the symptoms. Are there signs and symptoms of infertility in male and female?
I guess like the most common is that, you know, for both parties, like you're unable to have a baby. You know, that's the whole point of this conversation. So that's like most common symptom you see. But then in terms of signs, for females, some signs that should clue you in such that you can then go for further investigation is if you're noticing that you don't see your period at all. Okay.
You don't see your period at all?
Your period at
okay.
Yes.
Okay.
So if a female, you're not seeing your period like at all. Like I mean, you know, like as a female right now, say like in your 20s or so, you're noticing that you're not seeing your period at all. That should clue you in that you need to like, you know, go to the hospital to do some investigations. Or if like again as a female, like let's say you have one period now and then you miss like say 3 months, 4 months, 5 months, you're having irregular menses, that again should clue you in for you to go get checked out, right? Because that could mean you're hormonal imbalance. So you should want to go and check that out. Another sign is if you're having very, very severe pain during your menses. Okay, so if you're having very severe pain that requires you to be hospitalized during your menses, you go and check that out as well, because you could have some endometriosis. So if you're having very painful periods that require hospitalization, you need to go and check it out, because that could also be a sign that you have something else going on that could potentially be infertile down the line, right? Then another thing is when you're having very painful episodes during sex.
Okay.
So basically, you're trying sexual intercourse, but you cannot go through with it because of very severe pain. Again, that's something you want to go and get checked out in the hospital as well.
Okay.
And other symptoms would include if you are seeing discharge from your vagina, mostly the smelly type of discharge, like smelly, fishy odor kind of discharge from your vagina. That should again give you a clue that you need to go and get checked out. Or like if you notice you have very dry vagina, most times that's noticed when again you're having sex and you're seeing blood coming out during sex from having very dry. Again, you need to get checked out.
Okay.
So these are signs.
Okay. You let me just translate that. Maybe are there signs for the men?
Oh yes.
Okay, we'll come to that. We'll come to that very soon. Let me just translate that. Wọ́n ṣàlàyé wípé àwọn àpẹẹrẹ tí àwọn obìnrin máa rí tàbí máa mọ̀ wípé this can be infertility. Ó ní wípé wọ́n sọ oríṣiríṣi. Wọ́n ṣàlàyé pé bóyá irregular period ẹ ṣe kó oṣù ní mọ́ǹtì ẹ lè má rí ní bí oṣù 3 oṣù 5 kẹtù ṣẹ̀ṣẹ̀ tó wá rí. Wọ́n ní ara àwọn àpẹẹrẹ nìyẹn. Wọ́n tún ṣàlàyé wípé bóyá ẹ ń ṣe bóyá fún àwọn tó bá ti marry you get táwọn á ṣe àwọn exercises yẹn pẹ̀lú ọkọ wọn. Wọ́n wá notice wípé ó ń dùn wọ́n gan. Kí ló ṣẹlẹ̀? Tí wọ́n bá fẹ́ ṣe ìbálòpọ̀ ẹ ṣàánú wípé wọ́n máa ń dùn yín gan. Ara àpẹẹrẹ kan tún nìyẹn. Mo ṣàlàyé wípé bóyá ẹ notice wípé ẹ ń ṣe ẹ wá rí ẹ̀jẹ̀. Ara kan tó tún jẹ́ àpẹẹrẹ nìyẹn. Wọ́n tún wá ṣàlàyé wípé bóyá ẹ ti ẹ̀sìn ìbálòpọ̀ báyìí ò bọ̀ ẹ wá notice pé máa rí àwọn discharge láti ọmọ jáde lára yín. Bóyá àwọn discharge tó ń bí ẹja and all of that. Wọ́n ní ó ṣe é ṣe kó jẹ́ pé àpẹẹrẹ kan tó tún jẹ́ àpẹẹrẹ àìrọ́mọbí infertility ohun tún nìyẹn. then mo gbàgbé láti sọ lẹ́ẹ̀kan gbà tán sọ̀rọ̀ nípa nǹkan tó lè fa àìrọ́mọbí lára obìnrin. Wọ́n ní pé tóbìnrin bá ti ń ṣẹ́yún jù, multiple abortion wọ́n sọ, tóbìnrin bá ti ń ṣẹ́yún jù, tẹ́ bá ṣe ń ṣe one after the other, ó máa affect ilé ọmọ táwọn pè ní womb, ó máa affect ẹ bẹ́ẹ̀ pé for instance sin bóyá èèyàn ṣubú bí ara tí injury wà ń bẹ̀, same place, ṣe mọ̀ pé kò ní remain the same. So that's the same with ilé ọmọ bó ṣe ṣàlàyé wípé your womb will be scarring, ẹ máa affect ilé ọmọ yín díẹ̀ tó bá jẹ́ pé ẹ ń ṣe tẹ́ ń ṣẹ́yún léra. All right, doctor, now you've told all of that, all the signs for the females. Wọ́n dẹ̀ ṣàlàyé wípé fún ẹni tó bá ní àìrọ́mọbí problem yẹn, the symptom is ẹni ìrọ́mọbí nìyẹn, that's the symptom of infertility, not being able to give birth, ẹni ìrọ́mọbí òun nìyẹn. Now ẹ jẹ́ ká bọ́ sí àwọn àpẹẹrẹ fún àwọn ọkùnrin. Báwo làwọn ọkùnrin ṣe máa mọ̀ pé ó dà pé mo ti ní àwọn signs fertility lára? What are the signs for the males?
Okay, so again, for males, the most common signs you will see again is for those who are having multiple or recurrent infections. You might end up having discharge from the tip of the penis. You might also have pain or redness of the scrotum, right? Especially if there's an infection going on there as well. You might also feel like your scrotum is like swollen as well. You can also notice that you are unable to, like we call it erectile dysfunction. That's like when you're unable to gain an erection during sexual intercourse, or you're unable to last during the period like you would normally have, during sexual intercourse. Those are like the most common symptoms you would see with men.
Okay.
The most common things, I mean.
Okay. All right. Wọ́n ṣàlàyé pé discharge lára ọkùnrin fún àwọn àpẹẹrẹ tí àwọn ọkùnrin máa rí tó mọ̀ pé infertility ti fẹ́ wọ̀, ó ní discharge látara ọkùnrin, bóyá wíwú níbi apá kan tó wú, and then wọ́n ṣàlàyé pé tó máa dùn yàn. Ṣàpá sọ́tò obìnrin náà tẹ́lẹ̀ pé tí wọ́n bá ń ṣe ìbálòpọ̀ tó máa dùn wọ́n gan, tàbí tẹ́lẹ̀ ń jáde fún ọkùnrin, tàbí kó jẹ́ pé wọ́n ní erectile dysfunction, bó ṣe kó gbéra kò gbéra, tàbí period tó yẹ kó fi gbéra sí kò tún gbéra bẹ́ẹ̀ yẹn. Wọ́n sọ pé ara àwọn àpẹẹrẹ téèyàn máa fi tó fi ní pé ó ti ní infertility ò nìyẹn. Ọmọbìnrin mo tún sọ lẹ́ẹ̀kan ìgbà tí wọ́n ṣàlàyé lẹ́ẹ̀kan fún àwọn àpẹẹrẹ táwọn obìnrin máa ní, wọ́n ṣàlàyé pé tí èèyàn tóbìnrin bá ti ní orí nǹkan oṣù tó wá ń dùn gan, tó di pé wọ́n máa gbé lọ sí hospital, ẹ pé orí nǹkan oṣù tó dẹ̀ ń dùn gan, tó fi di wípé ó gbọ́dọ̀ lọ sí ilé ìwòsàn káàrẹ̀ tó wà alright, wọ́n ní pé ọ̀rọ̀ àpẹẹrẹ láfi mọ̀ pé ó ṣeé ṣe kó jẹ́ pé ní máa ní infertility, ohun tó nìyẹn. All right, doctors.
Then again, exercise.
Okay.
30 minutes a day.
30 minutes a day.
5 days a week.
Okay.
Yes, that's like the most important one. So as a man, you want to stick to your wife. As
a woman,
you want to stick
to your husband.
Or again, this may be.
Okay. All right. Okay. So as regards prevention, bá ṣe lè dènà níní nǹkan tá à ń sọ nípa àìrọ́mọbí infertility, ò ní wípé wọ́n ti ṣàlàyé lẹ́ẹ̀kan àwọn nǹkan tó lè fà á. Tẹ́ bá ti lè mọ̀ nǹkan tó lè fà á, ẹ sá fa nǹkan tí ó yẹ kẹ́ ẹ fa sìgá, fa gbó, fa days, fa dat, ẹ jọ̀ọ́ ẹ sá fún. Ànígẹ́ wọ́n ṣàlàyé pé mọ́ sí eré ìdárayá, ṣé wọ́n pa ti sọ lórí ètò yìí, eré ìdárayá ṣe kókó, ṣe pàtàkì. Who would have thought that one of the ways to prevent infertility ni pé ká mọ́ sí eré ìdárayá? Ṣé ti gbọ́ báyìí? Eré ìdárayá ṣe kókó, ṣe pàtàkì, both for male and for female. Bẹ́ẹ̀ jó obìnrin bẹ́ẹ̀ jó ọkùnrin sí eré ìdárayá, ẹ jọ̀ọ́. Ní wọ́n dẹ̀ ṣàlàyé wípé ẹ stick sí partner kan, àti sọ tẹ́lẹ̀ bí dókítà wa ṣe sọ, ẹ focus lórí ẹnìkan, ẹ yé mọ ní 1 2 3 4 5 6 7 8 9 10, bójú obìnrin bójú ọkùnrin, stick to your partner, be faithful to one person. Ó ṣe kókó, ṣe pàtàkì. All right, so let's come to the treatment and then we'll open the phone lines.
Okay. So with regard to treatment, it would be very specific to what the problem is.
Okay.
So what I mean is, for example, if the problem is infection or like STD, as the case may be, then we just treat that like embarrassed, or they feel like it's a shame to talk
That's
about.
Another
things
issue.
Like this. It's not.
Mm.
It's not. If you you're having symptoms, you're having discharge from your vagina or from your penis, please come to the hospital. We will do the necessary testing and give you very specific antibiotic based on what's causing that problem for you. So that's it about the infection. And if you say, like, for example, you have hormonal imbalance, then we'll try to regulate your hormones based on which is imbalanced, whether it's in the male or in the female. Yes, and for some ladies, the problem is having irregular menstruation. Again, depending on, we can do tests to figure out why irregular menstruation and give medications to regulate your menses, which will help you get pregnant. And then, I'm sorry?
Yeah, please go ahead.
Yes, and then there are sometimes we do everything possible. We do extensive, and we can suggest other treatments like IVF and and the likes. But it's just that those treatments are like very expensive. But again, they're like the result when we have tried all investigations and we cannot find out what's really going on. The major thing when you are having this issue with infertility, the man and the woman need to come to the hospital. There are tests that will be done. The man would have to give his sperm sample. The woman would have to do samples and urine samples, and then we can, based off all that, we find out what the exact cause is, and then we can treat.
Okay. Thank you very much. Now, Dr. wa ṣàlàyé pé bá ṣe lè tọ́jú wọ́n dẹ̀ ṣàlàyé pé bóyá àgbà tẹ́ bá lọ sílé ìwòsàn wọ́n ṣe àyẹ̀wò fún yín wọ́n wá rí pé kan pàtó báyìí ló fà báyà kì í ṣe kátà lára àwọn nǹkan tí wọ́n ti ṣàlàyé tẹ́lẹ̀ wọ́n máa fún yín ní àwọn advice bẹ́ẹ̀ ṣe àtàbí nǹkan tẹ́ lè ṣe bóyá ẹ ṣe kátà mọ̀ pé ní IVF ní o tàbí oríṣiríṣi náà máa ṣe. That is if wọ́n check yín wọ́n ṣàyẹ̀wò fún yín wọ́n dẹ̀ rí wípé kò sí ara àwọn nǹkan tá lákàlẹ̀ tẹ́lẹ̀ láti fi lè tọ́jú yín ṣó ti yé wa. Wọ́n dẹ̀ ṣàlàyé sí wípé wọ́n tún mẹ́nu bà wípé ẹ jọ̀ọ́ ẹ rí dájú wípé you stick to one person. Ẹ focus lórí ẹnìkan, ẹ má focus lórí èèyàn mẹ́wàá, èèyàn méjì, èèyàn mẹ́ta. Ẹ focus lórí ẹnìkan. Be faithful to your partner. Ó ṣe kókó, ó ṣe pàtàkì. Alright, and then wọ́n tún ṣàlàyé wípé tó bá jẹ́ wípé obìnrin ni tó jẹ́ pé obìnrin ló ń go through kíní yẹn ká àtọkọ àti ìyàwó ẹ lọ sílé ìwòsàn go together. Kò sí wípé it is only the woman yẹn ni problem, kò túmọ̀ sí yẹn. As long as the two of you are together, tẹ́ ẹ ti fẹ́ ra yín sílé ẹ jọ lọ sí ilé ìwòsàn, ẹ má dì sí ẹnìkan, ẹ jọ. Alright, doctor, let's open the phone lines because of our time. Let's open the phone lines and let's see if you can take one or two calls. 0705 500 1033 0905 444 1033 0705 500 1033 0905 444 at I-FLIER 103.3 FM live at I-FLIER 103.3 FM live. A máa tún ka àwọn kọ́mẹ́ǹtì yẹn náà. Tẹ́ bá ní ìbéèrè nǹkan tó bá fẹ́ bi dókítà wa láàárọ̀ ti tòní ẹ láǹfààní láti béèrè 0705 500 1033 0905 444 1033. À ń bọ̀.
Fruits and we vegetable all. Cause health is wealth. Vital is vital. You gotta take care of yourself. Health is wealth. Vital is vital. You can't rely on nobody else. Health is wealth. Vital is vital. Try and take care of yourself. Health is wealth. Vital is vital. You can't rely on nobody else. Don't you realize your body is a temple? Certain vitamins, they are essential. Some things are to detriment.
Because of our time, let's just start going. Ẹ jẹ́ kí ẹ tètè máa gbé gbogbo nǹkan tá a gbé wá sínú ilé agbára láàárọ̀ tí oníkà tètè máa dágbére. Dr. Okoye Favour, do you have any advice you want to give to our listeners? I know you have given the advice, but are there any other things you want to say to our listeners as regards this?
I think the only thing I just want to say is I truly believe that it's important for us to take care of our bodies. And this is not about, like you trying to stay healthy and all that. It's also out of respect for ourselves. And that's if you think and if you behave from that place, there are lots of things that will come naturally to you. For example, you want to eat better, you would want to drink water as much as you can, you would want to rest as much as you can. you would want to stick to one partner as much as you can. So my point is, if you take yourself very seriously and you tell yourself,